There.
Okay.
No.
Good morning. This is Jennifer Walz coming to you from Sedona Mago Retreat Center. And today we're doing the second part of post-COVID syndrome recovery with acupressure. And last month we focused a lot on points on the front of the body. And today we're going to focus on the bladder channel, which is on the back of the body. It starts in the corner of the eye and runs over the top of the head and goes all the way up and down the back on both sides of the spine. One of the great things about the bladder channel is that there are very important points in this channel for each internal organ system. And the point about correlates with where those organs are on the body. So for instance, we had questions from people who had continuing feelings of tightness and constriction in their chest, and people who were still suffering from palpitations when they were no longer infected with COVID any longer. So we're going to be able to work on points on the bladder channel that correlate with the lungs and correlate with the heart. And we're going to continue down the bladder channel, and we're going to help to stimulate all of the other points that are associated with all the different organ systems. So in Chinese medicine, there's a term called Wei Qi, W-E-I, Qi. And Qi is the vital life force energy. And the Wei Qi is the name for the defensive or protective Qi of the body. Basically, that correlates with the immune system. So when you build up your Wei of vital life force energy, which will help you to prevent from taking on anything that might make you sick. So we have a Mago. Because it's difficult for one to get to the acupressure points on your own back. You might be able to get one or two of them, but it's better for you to pair. So this point for the lungs can be used for any kind of congestion in the chest, any kind of residual cough. It can be used for asthma. And because every organ system is associated with an emotion, the lungs are associated with grief. So it might help the person to relieve some grief and sadness. So moving down from there, the next point is for the pericardium, which is the lining around the heart. And stimulating this point will also help with feelings of tightness in the chest, and will also help to relieve palpitations. And moving down again, about an inch or so, you'll get into the area where you can help to benefit the heart. This will also help with loosening the chest and with helping to resolve palpitations or a fluttering feeling in the heart. So we are going to presume that anyone who still is having these symptoms has seen a doctor and there is not anything clinically wrong, but you're still experiencing some uncomfortable symptoms from having had the virus. Points that help to benefit. And when you go towards the end of the spine, points to help benefit the bladder.
What else can I do for palpitations?
Okay, so the question is, what other points can we use for palpitations? So one good point that would be really great to use in conjunction with doing the points on the upper bladder channel would be Pericardium 6. So we've already addressed the pericardium and the heart here by working on the bladder channel. There is an excellent point that's just above the wrist called Pericardium 6. And the way that you measure that is going up from the wrist crease. You can bend your own finger in half. your knuckle goes on the wrist crease. And then where the tip of your finger falls, that is pericardium 6. And you want to palpate, feel around in this area a little bit, and you should feel an area in between the two tendons that are there on the wrist. And it's a fairly sensitive point. It's fairly sensitive when it's needled, but it feels good with acupressure. This point is used for so many things. It really helps a lot with palpitations. It helps with anxiety. It's used for motion sickness. You may have seen the seasick bands that are available in the drugstore that people will wear when they're going on a plane or on a boat, and that band actually accesses pericardium 6. It's also very good for morning sickness. Those wristbands can be worn all throughout the pregnancy if a woman is suffering from nausea or dizziness due to the pregnancy. But any of the pericardium points are going to help with palpitations, and this is an exceptionally powerful one. And this is one that you can do on your own wrist. So the technique is basically the same. You can either do a press and release on it and hold it for a few seconds at a time, or you can press down and do a little circular motion. You might start to feel the energy start to move. You might start to get some tingling sensations that go down into your hand, into one of the fingers, or you might feel some tingling start to go up your arm, and you know that you've hit the right spot. And that can be done on both wrists. That can be done on both sides.
We have another question.
We have another question.
Can the healer be used to put pressure on the back along the kidney meridian?
The healer, as in the belly button healer?
Yes.
Yes, you could do that, and you might, if you're flexible enough, you might even be able to reach around yourself and use the knobby part of the belly button healer. I could see putting the healer down on the floor and lying on it, or using it across the top of your back or on the lower back to apply acupressure with it. Yes, that would work well. If we have one handy in the room, I can demonstrate that later.
No more questions.
Okay. So I've also been getting questions about acupuncture. I do acupuncture here at Mago, and some people are still a little concerned about getting acupuncture. It's a lot more mainstream than it used to be, but there are still some people who are not familiar with acupuncture at all. And there have been some scary visions in some movies, some martial arts movies, and some TV shows that show really long and thick needles being used for acupuncture. So I'd like to demonstrate a needle that I typically use in my practice to do an acupuncture session. This is a 1/2-inch needle, and the orange part is actually just the handle. So the needle is so small and thin, it's only about the width of a couple of hairs put together. And generally, most people do not feel a lot of sensation from this. It is not anything like getting a shot with a hypodermic needle. A hypodermic needle is hollow, and it's more like it tears into the flesh. And this needle is so small and delicate that it's almost more like it parts the flesh and really doesn't cause a lot of sensation. So I'm going to be doing a point over here on the back, and I'm using a guide tube, and basically the needle is just tapped in, put into place, gently adjusted, and once the needles are in, they just stay in for about 20 minutes or so. Sometimes they can stay in longer depending on what we're working on, and the person will relax comfortably on the table. Usually they fall asleep, and after 20 minutes or so we just take them out. Another question I've gotten often is, do you use disposable needles or reusable needles? Almost every acupuncturist in about the mid-80s started to switch to disposable needles. Prior to that, everyone used stainless steel needles that needed to go through an autoclave to be sterilized. And once there became more of a problem in the country with contagious bloodborne diseases, everyone switched to disposable needles. So these are used once, and then they're put in a medical sharp container, and they're disposed of properly and not used again. We can see if there are any questions on that as well.
Are there different sizes that you may use?
That is a wonderful question. So I typically use the smaller needles, but if I was working on a different condition, say if I was working on sciatica, or a part of the body that had more muscle, or if I was working on a guy who was very big and muscular and was a bodybuilder, then I might need to use a thicker needle, because the thinner needles on somebody who's extremely muscular, they could literally bend. So we'd have a thicker gauge, and the length would need to be longer. Say to get into a point for sciatica, the point is kind of deep. So for that, I might need to use a 3-inch needle to access the point. There are even some needles that are more thin than this, and if someone has a big fear of needles, or if it's a youngster or a very elderly person, then I might use a brand of needles that comes from Japan that is super, super thin, and it's considered completely painless needle, and they're really just tapped in very gently and pretty much just stay at the surface. And most people are very comfortable with them. So that brings up another point as far as the ages that are the best for someone to get acupuncture. Typically, it's thought that a child younger than 7 does not have an energy system that's developed enough for them to get acupuncture. And I would usually stick with acupressure and maybe do some herbs with a younger child. And once someone gets to be past 80 or so, their basic chi starts to decline. And I take that on a case-by-case basis, because there could be an 80 or even a 90-year-old who is extremely vital and active, or an 80 or 90-year-old who has been ill for a long time, and it wouldn't be appropriate for them to get acupuncture. We also have to assess the condition of the skin, and if someone's skin is very thin and papery, acupuncture also would not be appropriate for them.
How does acupuncture help you with the COVID symptoms?
So we're working on each person individually, and I do a full health history before I work on someone. So my interest is, how were you before you got sick, and what's going on with you now? So there's a number of different ways that I can help to assess what's going on with a person and where they need the most help. One of the things that we do in Chinese medicine, and this might be a topic for another broadcast, is I do a pulse diagnosis. So on each arm, we do a 3-finger pulse diagnosis where every finger position represents a different organ system. And we do that on both hands. Different organ systems are related to each hand. And that will help me to find out, along with what symptoms the person is expressing to me, that will help me to find out where their qi deficiencies are and what kind of damage had been done from any illness that they might be going through. Another thing I do is a tongue diagnosis, and that would be a fun thing to do another broadcast on, because it's very interesting to see how different people's tongues can look. And there are many different factors that I look for when I'm doing a tongue diagnosis, as far as if the tongue is swollen, what color the body is it too pale, is it too red, does it look slightly purplish? All those things give me clues as to what I need to do to help that person to feel better. So combining the diagnosis and the symptoms that they're reporting, I'll use certain points that are related to whatever symptoms they have reported to me, as we did before. So using the bladder channel as an example, these points also happen to correlate to where spinal nerves come out of the spine and help to innervate those different organ systems. So besides the energy, the chi that we're working with in acupuncture, there's actually Western medicine correlations between working on this is going to help to make that organ system stimulated and help it to function more effectively. Good question.
We have another. Is it safe to go to a communal acupuncture clinic during the COVID-19 pandemic?
Well, I think that it might be getting safer at this point. Now that more people are getting vaccinated, I would not have gone to a community acupuncture treatment early in the COVID pandemic. People are generally treated close together. So I would want to see what kind of precautions have been taken. People would have to be spread out more. The practitioner would need to be sanitizing their hands in between going from person to person. So I think that shortly, maybe within a couple of months or certainly by the end of the year, it would be an okay idea to go to community acupuncture. For right now, it most likely is safer to work one-on-one with someone and continue to wear masks.
Okay. When you rotate, is it clockwise, counterclockwise?
Also, that is a good question also. So it gets into a little bit more of complexity as far as diagnosing what's going on with the person. So in general, and when we do acupuncture needles, if we're trying to release excess energy, we go counterclockwise. If we're trying to put in energy to an area that feels weak, then we use a clockwise rotation. So if you have a fairly recent injury and a lot of pain, you might do a very gentle clockwise rotation. If you're working on someone's low back that has a chronic injury and it just feels sore and it's felt very weak for a long time, then you would use a clockwise rotation and visualize putting in more chi, putting in more energy into that point. And in our next broadcast, we might also talk about using moxibustion, which is another way of working on the acupressure points. And this actually helps to put heat into the points. And this feels really good if someone has a condition that's very weak and really needs to bring their chi up. And it's especially good to use on the low back in the kidney area to help to increase the kidney chi. So I'm going to be removing the needles. So you can see they just come out very easily. And they'll be placed into a hazardous waste container and disposed of properly.
Could you demonstrate the healing?
Yes. So if you wanted to use the belly button wand or the Gila on another person, you can use either the snobby part or you can use one of the edges to help massage. And if your hands tend to get tired, this actually it's good to use a tool to help with this. So you could be using this instead of your thumb and gently pressing in, doing a little circular motion. Then moving down about an inch, and pressing in. You'd be asking for feedback from the person that you're working on to make sure that you're not pressing too deeply. And we want it to be at a hurt so good level for them. So we don't want it to be too strong that they're starting to tighten up against it, because that would be counterproductive. So you could work your way down the spine with the knob. And we usually go from top to bottom. Or you can use this larger part and use that to do some massage. This is actually a very comfortable back massage tool. Again, using the knob. At the end, you can go straight down, making sure not to go over the spine, because that isn't comfortable. And this would help you to pretty effectively move the energy along the bladder channel. So after any acupressure or acupuncture treatment, you want to make sure to drink extra water. Generally, there's a little bit of a detox reaction. You might find that you need to use the bathroom more. And it's good to drink extra water to make sure that you're flushing out any of the toxic waste products that tend to build up in a sore muscle. So you want to flush them out so that you don't get a headache or feel too tired. It's normal to feel a little bit sleepy after you get a session, and it's good to be able to listen to your body, rest if you need to, drink extra water, eat some healthy food, and help yourself.
Get a consultation from you?
Yes, there is a way for a person to get a... If you think of any other questions, please feel free to put them in the comments, and we will see you next month. Thank you.